If you're having knee pain and you're wondering what could be the cause of your knee pain, here's one of the possible causes that could be causing your knee pain, and that we just saw in one of our patients in a clinic the other day. This lady was having knee pain because of two issues that we've kind of uncovered for her. And she's at an aha moment of the things we've explained to her of why she might be experiencing knee pain because of these two things. Now, to give you some context, she was skiing in the Alps back when she was young. She's a nurse, so she's a fairly active individual who's now slowed down quite a bit and walks with a cane. So she's somewhat accept the fact that she's slowed down a little bit. And she's frustrated by the fact that she's not used to be able to do the things or walk at the pace that she used to because of the knee pain. And that she used to be a fairly active individual, and now she's not. And she probably has difficulty keeping up with her friends. And that she feels like a burden to her friends when they're walking together. Or when they go out for outings and she can't walk for as long as she likes to and be able to keep up with her family and friends when they're out and about. So that's a frustrating part for her. And that's something we've been working on with her to increase her endurance and strength so that she can do more of those things with her friends and families when she's out and about. Because at this point, that's what's important to her. Secondly, we've identified that she's got a leg length discrepancy. So one leg is slightly longer than the other. And that's a problem. That's been called an imbalance in her gait, in her hips, in her knees, because she's going to put more weight toward one side than the other. So the leg length discrepancy, where one leg is longer than the other, there's two things that would cause that. One is she was born with it. Two, the functional. It was caused by an imbalance because of her hip or some other injury nagging injury that she's had, and that she's compensating for something else. So first we've got to determine if it's a true leg length discrepancy. Is it really the fact that her leg length is different? Or is it because her hip is hiked up and that's causing the length? Because of the fact that she might have a back pain that's hiking up her hip and she's walking like that. So that's the first thing we need to kind of differentiate for her to make sure that it was a true leg length discrepancy. Two, she's got a collapsed arch in one foot, but not the other. So now that throws in a second layer on top of the existing one. Because if you have collapsed arch in one foot but not the other, you're gonna put more pressure when you're walking on that collapsed arch. And depending on the foot that you have a collapsed arch in, that's going to impact the way you walk and where you put your pressure. And where you put your pressure on the bottom of your foot is going to go up the chain. Where it's going to hit your knees, it's going to hit your hips. It's all connected together in one. If there's something wrong with one or the other, it's going to affect the entire link. And the knee is usually what we call the monkey in the middle. It's a joint that's made for stability. It's meant to stabilize. So if there's something wrong with the hip or the ankle, guess who suffers? The knee. And we've got to figure out if it's the hip that's causing the knee, or is it the ankle that's causing the knee, or is it both? Because the hip tells the knees what to do, the same way your parents tell the kids what to do. And it gets reversed as they get older. But that's what's going on with the knee, and that's what she was complaining of. So we've got to address those two things first, and we've got to tackle it one at a time to tease out, to see if the leg length discrepancy is what's causing the knee first, and then to look at the arch of her foot. So it's a two-step process. So those are two things that could cause knee pain, and it needs to be evaluated thoroughly to figure out what is causing which.